So community engagement can support the establishment of running a biobank in several ways. But again, it also depends on where the biobank is going to be situated. So again, if you are going to do it in an urban setting, you may want to go beyond just using a community engagement approach, which is more likely to be specific to a particular target community. To do more of a public engagement, use a public engagement strategy to make sure that first of all, people understand what a biobank is, why a biobank is being established, what type of human biological samples would need to be collected from which community, whether it's being collected at the community level or the hospital, at the hospital setting. All these need to be clearly explained, both at the public engagement level and then also at the level of the community. What we need to understand, and of course, we've had examples and also several research have been conducted that suggest that when researchers seek to obtain blood samples for research purposes, it often generates a lot of sensitivities because people have personal attachment to their blood. So sometimes some people may not understand why blood is being collected for research purposes, particularly if the blood is being collected from someone who is healthy. If it's being collected in a hospital setting from patients, sometimes it makes sense because the patients know that when they go to the hospital, their blood samples will be taken for diagnostic purposes. And then if it's done in a research setting or done in a teaching hospital, that blood could also be used for research purposes. So there's a clear understanding of why there may be the need to collect human biological samples like blood from a patient in a hospital setting. The challenge is collecting blood samples at the community level, particularly collecting it from people who are healthy, and how to explain to them that the samples are going to be used only for research purposes can be a bit tricky. So this is where community engagement comes in. And beyond community engagement, doing a more public engagement to allay any fears that individuals may have about what their samples are going to be used for. In many African settings, people also have some misconceptions, or they also have some, beliefs that sometimes people use blood samples for other bad purposes, like for rituals, for money rituals. And there's literature to suggest that yes, when people are engaged, when researchers are engaging community members to conduct clinical trials that may involve follow-ups and the collection of blood samples, or genomic research and biobanking that would require the collection of blood samples, questions are often asked about what the samples will be used for, where the samples will be stored, who is going to have access to the samples, and particularly when the study involves international collaborations and the samples are likely to be shared with international collaborators outside. The question would often be, why are you sending my blood samples to a country I've never been before? So these questions do come up. So this is where community engagement can actually play a key role to allay any fears that community members may have, and to use also innovative ways, like similar to what I discussed earlier, using animation to demystify biobanking. In fact, in one of the research that I've been involved in, what we have done is to develop a tool, an animation tool that sort of tries to explain the basic understanding of genetics and biobanking and the rationale for obtaining human biological samples. In addition to that, what we have done is to try to document the journey of the sample from when it is collected from the individuals to how it is handled at the biobank, what analysis are being done, how it is stored, and then also how the samples or even data generated from the use of those samples are also shared. So that tool is a powerful tool to really not only demystify genomics and biobanking, but also to bring sample donors and their communities to the lab, to the biobank, to understand that when these blood samples are collected, they are not being sold, for profit, or they are not being used for rituals or for juju, as we will say in Africa, but they're actually being used to answer specific questions. That these samples or these biobanks, that the samples that are stored in biobanks, are a scientific resource that are aimed to address specific research questions and also to facilitate future use. So I think if we are able to use innovative ways of breaking down the science, demystifying biobanking, bringing target community members to the biobank and the labs to really see what their samples are being used for, it can help address a lot of the challenges or concerns that individuals may have. And it can actually do what we call promote genomic and genetic literacy within many communities, and also ensure that when people are submitting or donating their blood samples to a biobank, they have a clear understanding that they are contributing to science, and that the findings from these research activities are also likely to not only benefit them, but could also benefit generations to come.